Have you ever eaten a meal and not too long after you're feeling exhausted? You could genuinely take a nap. You might feel shaky, your heart might be racing, you can't think straight, you're really foggy, or maybe even you feel hungry again, even though you just ate an hour ago. Well, if you have POTS or dysautonomia, there is a reason behind this. You're definitely not imagining it. There's something called reactive hypoglycemia, and I'm going to talk about what it is, why it happens in people with dysautonomia and POTS, and some strategies with how to support it, so that hopefully you can focus on nourishing your body with meals and snacks across the day and not having that impact your energy and your ability to just go about the rest of your day. Now, before we get started, a quick disclaimer: this video is for educational purposes only. It's really important that if you are experiencing frequent or severe blood sugar drops, please speak to your GP or medical team before assuming that this is your picture. So what is reactive hypoglycemia? Well, essentially it explains low blood sugar or a drop in blood sugar after eating. Now, the clinical reactive hypoglycemia is where we look at blood sugar levels have dropped below the kind of safe or normal reference range. Whereas we can see in some people with dysautonomia or POTS, it might not be true clinical hypoglycemia that we are seeing. We may experience these symptoms after a meal and test blood sugar levels and things are within normal ranges, but it is actually the response to that rapid drop and sudden drop in blood sugar levels after a meal that can still cause symptoms even if things are still within range. A way that I like to think about that to better explain it is if you think about a roller coaster. I'm not a roller coaster person, but hypothetically, if you're on a roller coaster and you drop, but you don't drop below ground level, your body is still responding to that sudden drop. And that is really understandable that that drastic change can feel not so great. So again, with your blood sugar changes, even if they're not clinically low, that sudden drop down can feel awful, can lead to symptoms like dizziness, brain fog, palpitations, tachycardia, etc., etc. And I've definitely heard from a lot of people that they fall asleep directly after meals and have such a severe increase in symptoms that it is really challenging to manage. Or I see a lot of people who can have it impact their day, but maybe not as significantly. So why does this happen in POTS and dysautonomia? First of all, we don't 100% know why. We're still needing a lot of research and understanding in a lot of areas of POTS and dysautonomia. But before we jump into the current hypotheses, it's actually probably really important for me to first explain what happens when we go through the process of digestion, and in particular when we're digesting carbohydrates or carbohydrate-rich heavy meals. So what usually happens is, food, and let's say maybe more carbohydrate heavy food goes into our digestive system. Carbohydrates are broken down into glucose and released into our bloodstream. Now, when that happens, our body responds by releasing a hormone called insulin. And I think about insulin as the usher molecule that helps glucose be uptook by cells to have our blood sugar levels actually staying within these kind of narrow reference ranges. So they're not too high, they're not too low. It's a pretty normal day-to-day process that happens in everyone's body. What can happen in POTS and dysautonomia is a overshoot of the release of insulin. We can release too much insulin for the amount of glucose or carbohydrates that have been released, and this can maybe be triggered by those more carbohydrate heavy or like higher glycemic index carbohydrate type meals or snacks, because there is a more sudden release of glucose into the bloodstream. And with an autonomic nervous system that is already struggling to regulate multiple different processes, digestion included, this is where we can see this overshoot effect. So again, we don't fully exactly understand the mechanisms as to why, but we have a pretty good understanding that this may be a possible pathway. Another factor to consider is when insulin is released, it is normal and a part of the process of digestion for that to cause vasodilation, which is the expansion of blood vessels so that we can have more blood flow around our gastrointestinal tract to help with this process. Now, if we think about a POTS and dysautonomia body, we know that vasodilation and blood being drawn away from our gastrointestinal system, away from our brain and towards our gastrointestinal system, might be a bit tricky to also navigate and might further complicate this picture, particularly if we're, normally sitting at a dinner table when we're eating a meal, for example. Feet might be on the floor, blood's pooling, already further away from our brain, and then we add in blood rushing to our gastrointestinal system, and that can also cause these symptoms. So for some people I see both having an impact. For others it might be more the change in blood sugar levels, and for some it might actually be less so the change in blood sugar levels and more so the rush of blood to the gastrointestinal system. Now, a lot of people, when I explain that, the first thing that they might be thinking or that they might say to me is, oh, so this means that I need to cut out carbohydrates completely from my diet, right? And my answer would be no, please no. And I think a lot of people as well have seen, a lot of advice on the internet of like, what to do with POTS, how do I help myself? Because that's what a lot of people do in the chronic illness community, because we don't have the answers in many other spaces. You might see that, a low carb diet is recommended or avoiding carbohydrates. But I think it's actually really important to recognize that this, to me, feels more like a band-aid. It's not actually understanding that we can keep a pretty significant and important food group within our diet that helps with energy availability when fatigue is already a big challenge, and digest them better, because there are multiple factors that play a role within this picture, and therefore there are multiple layered factors that help. So I'm going to go through some of the strategies, and I'm actually going to start with the ones that are less focused on tweaks and changes in your diet and more about how we go about eating. So the first is small and frequent meals and snacks spread across the day. The longer that we go without energy intake, without food, without glucose being released into our bloodstream, the harder that it is for a dysregulated autonomic nervous system to regulate this process. So basically, if we swing from, having something to not having much to waiting until we're ravenously hungry to eat, we eat a larger meal, we might be more likely to gravitate towards solely using carbohydrates, or more easier to digest carbohydrates because things feel really drastic and our body goes, we need something ASAP, and then we're more likely to have that response. If we kind of stick with that balanced approach across the day, eating every few hours, making sure that we're having a balance of things, which I'll get to, this can absolutely be more likely to help regulate this process. Another thing that we think about is regulating our nervous system. I've mentioned our autonomic nervous system and how much it plays a role within this process multiple times already. And so it makes sense to focus on nervous system regulation, and particularly when our autonomic nervous system has two states, our sympathetic fight or flight and our parasympathetic rest and digest. If we have dysautonomia and POTS, we're more likely to be in that sympathetic fight or flight response. And therefore, if we're trying to eat a meal without trying to guide our body gently to that parasympathetic rest and digest, this makes this much more likely to happen. So focusing on nervous system regulation, resting physically, but also recharge around meals, and posture and blood flow, so putting your feet up, not actually having them on the floor and worsening blood pooling. This can actually be a really helpful tool in reducing the likelihood of this happening. Another one that is not necessarily exactly specifically food related, but it is the POTS bread and butter, pun not intended, having adequate hydration and salt, because blood flow plays a massive role within this process, and we know that insulin causes vasodilation if we are already starting at a baseline of a lower blood volume because we're not drinking enough and we're not retaining enough with adequate sodium, which is what we know is needed for a majority of people with dysautonomia and POTS, not everyone, but a lot. Then if we're not addressing that, this can make this picture, again, even more likely to happen. And so focusing on that throughout the day when we can is really important for this process. Now, of course, there are things that we can do to support this with food. I wasn't going to not mention it, but of course I'm going to leave it to last because I like to make sure I highlight to a lot of my patients that this is a layered approach. Yes, we can definitely make big changes with food and it can be helpful, but those changes can seem much less daunting if we have a really good baseline of the other strategies that I mentioned first, and then we see a much greater effect of, I guess, the wiggle room that we have with food. So the strategies that I'm now going to talk about is focused on carbs, but it still isn't cut out carbs. It is focusing on lower glycemic index carbohydrates or more complex fiber-rich carbohydrates. Obviously, this is actually not the most supportive recommendation for everyone. We know that we can see individuals with POTS, maybe more so alongside the hypermobile EDS, connective tissue disorders, HSD presentation, where there is that slower motility throughout the digestive system that we can see, and gastroparesis type pictures can be present, and something really high fiber might be a bit too challenging for the body to break down and may cause other symptoms like nausea and pain and vomiting, etc. However, still gravitating towards lower GI carbohydrate sources can be a really good place to start, and just seeing what you tolerate is always something that I encourage my patients, and I might give some examples of, okay, this is where we're currently at, we don't need to go all the way over here, but let's maybe meet here. That is very metaphorical and not very specific, but unfortunately this advice needs to be very specific and individualized because everyone is different. Lastly, a way that we can also support our body without even touching carbohydrates is actually making sure that we are having protein, fat, and again, fiber as tolerated, or different types of fiber with our meals and snacks. I like to say a very cringy saying in session of, you know, our snacks need a friend. We can't just have one macronutrient be the focus and the star. We kind of need to at least pair them with something else to help them be more sustaining in terms of energy, but also to help with that more steady release of carbohydrates or glucose into our bloodstream. And then also we need to make sure that our meals have all of our different macronutrients available so that they are balanced, and that automatically does also help lower the overall glycemic index of that eating occasion, which therefore helps with blood sugar regulation. One of the biggest takeaways from today's video is that reactive hypoglycemia, or this picture that I've explained of crashing after meals, isn't always about blood sugar. It is about your nervous system, your circulation, your metabolism, and so much more. Diet can absolutely make a huge difference, but it's one of the puzzle pieces in the full puzzle picture. And I think that's really important to consider. Following this video, I have asked one of my colleagues at AHC, Rhea, who's an exercise physiologist, to do a video on how exercise, pacing, and movement can also play a role in blood glucose management or reactive hypoglycemia pictures in people with POTS. So if you're interested in that, make sure you subscribe, follow along, and have a look. And if you found this interesting, let us know.